Good morning, my name's Jonathan Hobson. I'm an ear, nose and throat surgeon, and today's operation I'm going to be talking about is a tonsillectomy. We often perform these in children. There are two main reasons why we do tonsillectomies. One is because of recurrent tonsillitis, the pain that you get with the sort of razor blade-like feeling when you're swallowing food because your tonsils become infected time after time. We tend to take children's tonsils out if they're getting recurrent severe episodes of tonsillitis. And the other common reason for removing the tonsils is because of obstructive sleep apnea, where the tonsils are so large it causes problems with breathing, particularly overnight, with snoring, and during the day children are often irritable and sometimes hyperactive. Taking the tonsils out is relatively straightforward. We do it under a general anaesthetic, so we either give a gas to breathe to put you off to sleep or put a little drip in the back of your hand. After the general anaesthetic, we open the mouth and remove the tonsils. There are a variety of ways which can be used to remove the tonsils. Sometimes we cut them out, sometimes we use a form of heat energy to remove them. But ultimately we just take the tonsils out and allow everything to heal up. Tonsillectomy is one of the most commonly performed operations in the UK every year. It's very safe and very straightforward, but there are a couple of risks. All operations have risks of bleeding, and up to about 5 out of 100 children will have some bleeding after their tonsils come out, which often just requires an overnight stay and monitoring in hospital, but sometimes does require a trip back to the operating theatre and very rarely may require a blood transfusion. It's possible to get an infection after the tonsils come out. The best way of reducing the risk of this is to take regular painkilling medicines, to eat and drink normally, and sometimes to use some sugar-free chewing gum. The other risks are of chipping or injuring a loose or wobbly tooth, as we have to keep the mouth open to take the tonsils out. And it is sometimes possible to get a taste disturbance after the tonsils come out. We often send children home the same day after their tonsils come out, but sometimes we'll keep an eye in hospital overnight. And then the main pointers in terms of aftercare are to have regular painkilling medicines, to try and eat and drink normally, and most children don't require any formal follow-up after their tonsils come out, as they are cured of their underlying disease.